Surface marking and radiological. Introduction. Surface marking is the projection of deeper structures on the surface of body. Surface marking. The surface marking of important structures is described here: pleural lung, heart, and cardiac valves. Surface marking of parietal pleura. The cervical pleura is represented by a curved line forming a dome over the medial 1/3 of the clavicle with a height of about 2.5 cm above the clavicle, Fig 21.1. Pleura lies in the root of neck on both sides. The anterior margin, the costomediastinal line of pleural reflection, is as follows: on the right side, it extends from the sternoclavicular joint downwards and medially to the midpoint of the sternal angle. From here it continues vertically downwards to the midpoint of the xiphisternal joint, crosses to right of xiphicostal angle. On the left side, the line follows the same course up to the level of the fourth costal cartilage. It then arches outwards and descends along the sternal margin up to the sixth costal cartilage. The inferior margin, or the costodiaphragmatic line of pleural reflection, passes laterally from the lower limit of its anterior margin, so that it crosses the 8th rib in the midclavicular line, the 10th rib in the midaxillary line, and the 12th rib at the lateral border of the sacrospinalis muscle, Fig 21.2. Further, it passes horizontally a little below the 12th rib to the lower border of the 12th thoracic vertebra, 2 cm lateral to the upper border of the 12th thoracic spine. Thus the pleurae descend below the costal margin at 3 places: at the right xiphicostal angle, and at the right and left costovertebral angles below the 12th rib behind the upper poles of the kidneys. The latter fact is of surgical importance in exposure of the kidney. The pleura may be damaged at these sites. The posterior margins of the pleura pass from a 0.2 cm lateral to the 12th thoracic spine to a 0.2 cm lateral to the 7th cervical spine. The costal pleura becomes the mediastinal pleura along this line, Fig 21.3. Surface marking of the lung/visceral pleura. The apex of the lung coincides with the cervical pleura, and is represented by a line convex upwards rising 2 cm above the medial 1/3 of the clavicle. The anterior border of the right lung corresponds very closely to the anterior margin or costomediastinal line of the pleura, and is obtained by joining a point at the sternoclavicular joint, a point in the median plane at the sterna angle. Black small square, a point in the median plane just above the xiphisternal joint. The anterior border of the left lung corresponds to the anterior margin of the pleura up to the level of the fourth costal cartilage. In the lower part, it presents a cardiac notch of variable size. From the level of the fourth costal cartilage it passes laterally for 3.5 cm from the sternal margin, and then curves downwards and medially to reach the sixth costal cartilage 4 cm from the median plane. In the region of the cardiac notch, the pericardium is covered only by a double layer of pleura. The area of the cardiac notch is dull on percussion and is called the area of superficial cardiac dullness. The lower border of each lung lies 2 ribs higher than the parietal pleural reflection. It crosses the 6th rib in the midclavicular line, the 8th rib in the midaxillary line, the 10th rib at the lateral border of the erector spinae, and ends 2 cm lateral to the 10th thoracic spine. The posterior border coincides with the posterior margin of the pleural reflection, except that its lower end lies at the level of the 10th thoracic spine. The oblique fissure can be drawn by joining 1 a 0.2 cm lateral to the 3rd thoracic spine. 1 another point on the 5th rib in the midaxillary line, Figs 21.2 and 21.3. 2 a third point on the 6th costal cartilage 7.5 cm from the median plane. The horizontal/fis flora is represented by a line joining 1 a point on the anterior border of the right lung at the level of the 4th costal cartilage. 2 a second point on the 5th rib in the midaxillary line, Fig 21.2. Between the visceral and parietal pleurae the recesses are present. Costodiaphragmatic are present on both sides and are about 4-5 cm deep. Costomediastinal is prominent on left side, to left of sternum between 4th and 6th costal cartilage. Surface marking of the borders of the heart. The upper border is marked by a straight line joining a point at the lower border of the second left costal cartilage about 1.3 cm from the sternal margin, a point at the upper border of the third right costal cartilage 0.8 cm from the sternal margin, Fig 21.5. The lower border is marked by a straight line joining, 1a point at the lower border of the sixth right costal cartilage 2 cm from the sternal margin. 2a point at the apex of the heart in the left fifth intercostal space 9 cm from the mid-sternal line. The right border is marked by a line, slightly convex to the right, joining the right ends of the upper and lower borders. The maximum convexity is about 3.8 cm from the median plane in the fourth space. The left border is marked by a line, fairly convex to the left, joining the left ends of the upper and lower borders. Atrioventricular groove is marked by a line drawn from the sternal end of left third costal cartilage to the sternal end of right sixth costal cartilage. The area of the chest wall overlying the heart is called the precordium. Surface morking of the cardiac valves and the auscultatory areas. Sound produced by closure of the valves of the heart can be heard using a stethoscope. The sound arising in relation to a particular valve are best heard not directly over the valve, but at areas situated some distance away from the valve in the direction of blood flow through it. These are called auscultatory areas. The position of the valves in relation to the surface of the body, and of the auscultatory areas is given in Table 21.1 and Fig 21.6. Arteries. Internal mammary artery. It is marked by joining the following points: 1 a point 1 cm above the sterna end of the clavicle 3.5 cm from the median plane. 2 points marked over the upper 6 costal cartilages at a distance of 1.25 cm from the lateral sternal border. The last point is marked in the sixth space 1.25 cm from the lateral sternal border. Pulmonary trunk. 1 first mark the pulmonary valve by a horizontal line 2.5 cm long, mainly along the upper border of the left third costal cartilage and partly over the adjoining part of the sternum, Fig 21.6. Then mark the pulmonary trunk by 2 parallel lines 2.5 cm apart from the pulmonary orifice upwards to the left second costal cartilage. Ascending aorta. 1 Firet mark the aortic orifice by a slightly oblique line 2.5 cm long running downwards and to the right over the left half of the sternum beginning at the level of the lower border of the left third costal cartilage. 2 Then mark the ascending aorta by 2 parallel lines 2.5 cm apart from the aortic orifice upwards to the right half of the sternal angle. Arch of the aorta. Arch of the aorta lies behind the lower half of the manubrium sterni. Its upper convex border is marked by a line which begins at the right end of the sternal angle, arches upwards and to the left through the center of the manubrium, and ends at the sternal end of the left second costal cartilage. Note that the beginning and the end of the arch lie at the same level. When marked on the surface as described above, the arch looks much smaller than it actually is because of foreshortening. Descending thoracic aorta. Descending thoracic aorta is marked by 2 parallel lines 2.5 cm apart, which begin at the sternal end of the left second costal cartilage, pass downwards and medially, and end in the median plane 2.5 cm above the transpyloric plane. Brachiocephalic artery. Brachiocephalic artery is marked by a broad line extending from the center of the manubrium to the right sternoclavicular joint, Fig 21.8. Left common carotid artery. The thoracic part of this artery is marked by a broad line extending from a point a little to the left of the center of the manubrium to the left sternoclavicular joint. Left subclavian artery. The thoracic part of the subclavian artery is marked by a broad vertical line along the left border of the manubrium a little to the left of the left common carotid artery. Veins. Superior vena cava. Superior vena cava is marked by 2 parallel lines 2 cm apart, drawn from the lower border of the right first costal cartilage to the upper border of the third right costal cartilage, overlapping the right margin of the sternum, Fig 21.9. Right brachiocephalic vein. It is marked by 2 parallel lines 1.5 cm apart, drawn from the medial end of the right clavicle to the lower border of the right first costal cartilage close to the sternum. Left brachiocephalic vein. It is marked by two parallel lines 1.5 cm apart, drawn from the medial end of the left clavicle to the lower border of the first right costal cartilage. It crosses the left sternoclavicular joint and the upper half of the manubrium, Fig 21.9. Trachea, thoracic part. Trachea is marked by two parallel lines 2 cm apart, drawn from the lower border of the cricoid cartilage, 2 cm below the thyroid notch, to the sternal angle, inclining slightly to the right bronchus. Right bronchus is marked by a broad line running downwards and to the right for 2.5 cm from the lower end of the trachea to the sternal end of the right third costal cartilage. Left bronchus. Left bronchus is marked by a broad line running downwards and to the left for 5 cm from the lower end of the trachea to the left third costal cartilage, 4 cm from the median plane, Fig 21.10. Esophagus. It is marked by two parallel lines 2.5 cm apart by joining the following points: 1. 2 points 2.5 cm apart at the lower border of the cricoid cartilage across the median plane, Fig 21.11. 2. 2 points 2.5 cm apart at the root of the neck a little to the left of the median plane. 3. 2 points 2.5 cm apart at the sternal angle across the median plane. 4. 2 points 2.5 cm apart at the left 7th costal cartilage, 2.5 cm from the median plane. Thoracic duct. It is marked by joining the following points: 1a. 0.2 cm above the transpyloric plane slightly to the right of the median plane, Fig 21.10. 2a. 2nd. 0.2 cm to right of median plane below manubriosternal angle. 3a. 3rd point across to left side at the same level. 4a. 4th point 2.5 cm above the left clavicle, 2 cm from the median plane. 5a. 5th point just above the sternal angle, 1.3 cm to the left of the median plane. The most commonly taken radiographs are described as postanterior, PA, views. X-rays travel from posterior to the anterior side. A study of such radiographs gives information about the lungs, the diaphragm, the mediastinum, the trachea, and the skeleton of the region. Take radiograph keeping both hands on waist to clear lung fields from scapula. Following structures have to be examined in postero-anterior view of the thorax. Soft tissues. Nipples in both the sexes may be seen over the lung fields. The female breasts will also be visualized over the lower part of the lung fields. The extent of the overlap varies according to the size and pendulence of the breasts. Bones. The bones of the vertebrae are partially visible. Costo-transverse joints are seen on each side. The posterior parts of the ribs are better seen because of the large amounts of calcium contained in them. The ribs get wider and thinner as they pass anteriorly. Costal cartilages are not seen unless these are calcified. The medial borders of the scapulae may overlap the periphery of the lung fields. Trachea. Trachea is seen as air-filled shadow in the midline of the neck. It lies opposite the lower cervical and upper thoracic vertebrae, Fig 21.12. Diaphragm. Diaphragm casts dome-shaped shadows on the two sides. The shadow on the right side is little higher than on the left side. The angles where diaphragm meets the thoracic cage are the costophrenic angles, the right and the left. Under the left costophrenic angle is mostly the gas in the stomach, while under the right angle is the smooth shadow of the liver. Lungs. The dense shadows are cast by the lung roots due to the presence of the large bronchi, pulmonary vessels, bronchial vessels and lymph nodes. The lungs readily permit the passage of the X-rays and are seen as translucent shadows during full inspiration. Both blood vessels and bronchi are seen as series of shadows radiating from the lung roots. The smaller bronchi are not seen. The lung is divided into three zones. Upper zone is from the apex till the second costal cartilage. Middle zone extends from the second to the fourth costal cartilage. It includes the hilar region. Lower zone extends from the fourth costal cartilage till the bases of the lungs. Mediastinum. Shadow is produced by the superimpositions of structures in the mediastinum. It is chiefly produced by the heart and the vessels entering or leaving the heart. The transverse diameter of heart is half the transverse diameter of the thoracic cage. During inspiration, heart descends down and acquires tubular shape. Right border of the mediastinal shadow is formed from above downwards by right brachiocephalic vein, superior vena cava, right atrium and inferior vena cava. The left border of mediastinal shadow is formed from above downwards by aortic arch, aortic knuckle, left margin of pulmonary trunk, left auricle and left ventricle. The inferior border of the mediastinal shadow blends with the liver and diaphragm. Tomography is a radiological technique by which radiograms of selected layers, depths, of the body can be made. Tomography is helpful in locating deeply situated small lesions which are not seen in the usual radiograms. Numericals. Anteroposterior diameter of inlet of thorax 5 cm, transverse diameter of inlet of thorax 10 cm, suprasternal notch, second thoracic vertebra. Sterna angle disc between T4 and T5 vertebra 2 and D costal cartilage articulate with the sternum. Xiphisternal joints, T9 vertebra. Subcostal angle between sterna attachment of 7th costal cartilages vertebral prominence, 7th cervical spine. Superior angle of scapula level of T2 spine. Root of spine of scapula level of T7 spine. Inferior angle of scapula level of T7 spine. Length of esophagus 25 cm, thoracic part of esophagus 20 cm, cervical part of esophagus 4 cm, abdominal part of esophagus 1.25 cm, beginning of esophagus C6 vertebra. Terminal of esophagus T11 vertebra. Beginning of trachea C6 vertebra. Length of trachea 10 to 15 cm, bifurcation of trachea upper border of T5 vertebra. Length of right principal bronchus 2.5 cm, length of left principal bronchus 5 cm.